So my name is Trevor John Kilpatrick. My position is Clinical Director of the Florey Institute of Neuroscience and Mental Health, but I also work at the Royal Melbourne Hospital as a clinical neurologist. That interest in MS research stemmed from when I was a neurology trainee. I was always very interested in research as a medical student, but when I was a trainee, it was apparent that neurology was a difficult area in terms of treatment. We could diagnose conditions, but we couldn't treat those conditions very well. And of the neurological conditions, my view was that MS was important. It needed better treatments. But also in my lifetime, I felt that there would be a real possibility of making or contributing to a meaningful difference, such that I felt that there were going to be treatments which evolved over the next 30 years, and it would be exciting to be part of that research program to deliver something meaningful to people with this disease. The program that Thomas Kalinchik and I synthesized is all about better understanding progressive MS. We want to be able to predict it, we want to be able to monitor it, and we want to invoke treatments that which can ultimately prevent it. Progressive MS is a complex issue, and we're trying to better understand how to really identify it. What we know as clinicians is that there are two artificial phases of multiple sclerosis. The first is the relapsing remitting phase of the disease, and we have treatments which inhibit those relapses, reduce their propensity to occur. The second phase is the progressive phase of the disease, and that on average comes on about 10 to 15 years after the onset of disease for those who are unfortunate enough to enter into that phase. But what we actually know is that the progression actually probably occurs in those people from day one. It's just that it's not revealed as clinically progressive disease. Over the last 20 years, since I've been witnessing the activities of MSA, I've been struck by how well they have achieved really important goals on behalf of both researchers and the MS community. And I think that what we as researchers want to do, and I think specifically myself and Thomas, is to return that support in spades. And hopefully we and others, both directly and indirectly, will be able to do that, such that in a few years' time, we can see that we're on the path to actually making meaningful differences for people at risk of progressive multiple sclerosis.